Hello, many patients often ask if they should take the medication, the Parkinson medication, with meals or without. And there is no 100% correct answer for this because every patient is totally different. Patients react to medications totally different. However, there are few points to keep in mind. Point number one, only levodopa will be affected by high protein meals. The other medication for Parkinson's are not, only levodopa. When I say levodopa, I mean Rytari and Sinemet. Point number two, there is no medication better than levodopa in 2023. Number three, there is no reason to be scared about taking levodopa. Levodopa is safe, and if your function is getting affected, this is the medication to take. The standard recommendation is to take your levodopa, your Sinemet, your Rytari, 30 minutes or 1 hour before eating, before your meals, or 1 hour or 2 hours later. That's the standard recommendation. However, this doesn't apply to everybody because patients are different. There is no way I can predict which patient will be affected by this issue and which patient is not going to be affected. There is no way. Nevertheless, based on some retrospective study, there are few factors. Number one, patients with early onset of Parkinson's disease. In other words, those patients that started having motor symptoms at age 30, 40, before age 50, they are more predisposed to have these problems. Also, patients with strong family history. For example, if your mother, if your father, if your sister, if your brother have Parkinson's disease, you might be more predisposed to have this problem as well. The problem is that protein and levodopa compete for the absorption at the level of the intestine and also in the brain, and potentially might limit the effectiveness of the levodopa, of the medication. The bottom line is that if you have question about this, you need to test yourself because there is no way I can predict which patient will be affected. One day you try the levodopa with a piece of chicken or steak or tuna to see if you notice any different when you take with the empty stomach. So that's the best way to test yourself. The last point I want to make is be careful limiting the amount of proteins because you might end up having protein malnutrition. Remember, proteins is extremely important in your diet. So you don't want to have that. So you have to be careful. Now, remember also that the amount of proteins in your diet depend on many factors. For example, your age, weight, if you have kidney issues, renal failure. So the amount of protein will depend on those factors. I highly recommend, if you have the chance, to see a dietitian. If you like this video, don't forget to subscribe to my channel. See you soon.